Welcome back to the Canadian Concussion Center's webinar series, which is sponsored by LIUNA, the Labor's International Union of North America. If you've been here before, I'm Leslie Rattan, and I'm really pleased to be moderating the webinar series, which was developed for people that have suffered concussion, families, as well as healthcare providers. And our sessions focus on various aspects of post-concussion symptoms, and typically, the way that it works is we have an expert speaker who speaks for about half the session. And then in the second half, you can get your questions answered. And our sessions recur every other Tuesday evening from 6 to 7 p.m. So I would just like, I think Christian is going to change the slide. I'd also like to acknowledge, before getting into things, the Indigenous peoples of all the lands that we are on today. Even as we meet virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast, we honor the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. For this evening's session, just a reminder, if you do have any questions, if you look to the bottom of your screen, you'll see a Q&A. So if you do have any questions, please enter your questions in the Q&A. If you're having any kind of technical difficulties, enter those into the chat, and Christian will get back to you and help you out. We're just going to also run a short poll, as we always do, just to get a sense of who is in the audience. I'll just give a second here for that to come up. And just while you're doing that, just so you are aware, on the Canadian Concussion Center's website, all of our talks are recorded and then archived. So you can always go back if there was, you felt like you wanted to watch something again, you can go back and watch it on the website. Okay, great. Thank you very much. So for this evening's session, I'm really pleased to welcome back Dr. Mark Bayley, who's going to be presenting exercise therapy for concussion. And Dr. Bayley is a senior scientist at the KITE Research Institute at UHN and Toronto Rehabilitation Institute, and also a professor of medicine at the University of Toronto in the Division of Physical Medicine and Rehabilitation. He's program medical director and physiatrist in chief at UHN Toronto Rehab, and he currently holds the Coriat Family Chair in Rehabilitation Innovations. Mark is interested in enhancing rehabilitation outcomes for people with brain and spinal cord illness and injury. He has led multicenter trials of guideline implementation, technology, and medications combined with exercise to enhance outcomes. His work has helped redesign rehabilitation systems in Canada. And with that, I'm going to turn it over to Dr. Bayley.
Thanks very much for the introduction, and thanks also to the Canadian Concussion Center and the team for inviting us to come and join. I'm just going to make sure I share my screen, and so you'll get started and just see if I get this screen. Okay. So what you're going to see in a moment is my presentation. And so in the next few minutes, I'm hoping that we can just share some things about why we should consider exercise therapy after concussion. And I've got a little teaser about exercise therapy before concussion. What is the right dose and intensity, and how to gradually return to activity? So it's important for us to do I know that if you've joined us for these sessions before, you will have heard about concussion before and what happens. But I think I'm going to just focus on, the important things around why exercise might help in concussion. So just a reminder that the brain is a consistency of a sort of stiff jello, and when the head is accelerated, the brain jiggles within the skull, and that causes stretching and straining of nerves. And there are certain areas that are vulnerable to this, and some of the nerves may be stretched, and some of them may actually be strained and break. And that's why we are always concerned about repetitive events. But the changes aren't just about the nerves being strained and stretched. We also know that the nerve cells, when they've been injured, have changes in the way they work. And so you may see changes in the speed at which they talk to each other. And we know that there may be changes in the chemicals when they talk to each other. So in this diagram or this video, you see that the nerves, the message goes down the nerves, and then the nerves connect to the next nerve by neurotransmitters or messengers that turn the other nerve on. And after a concussion, we know that there may be changes in the axons or the long arms of the nerves, and there may be changes at the level of those neurotransmitters. Maybe they don't release as fast, or maybe they are not working as well at the receptors. So these are important things to remember as we think about exercise. Another thing that we found in research we've done with the team at the Canadian Concussion Center, David Michaelis, who's one of our neuroimaging specialists, we've shown that the brain after a concussion has a change in the way it reacts to certain stressors. So we did a study where we enrolled people within a few days of their concussion, and we watched how their brain responded to inhaled carbon dioxide. And what we found was that those who have a concussion, they would have a much faster speed of response and way more opening up of the blood vessels and more sensitive than those that were not concussed. And so this tells us that it's very possible that part of the reason that exercise might work is it might restore the normal regulation of blood flow in the brain, because a lot of us think about blood flow as being like these pipes that are going up into the brain, but those pipes can be widened and they can be shrunk depending on how much blood and oxygen and sugar your brain needs. And so we think that the problem may be that there's a loss of some of the normal regulation of this blood flow. And then it's always important to talk about the vicious cycle that people get into after concussion. You can start anywhere you like on this cycle, but if you have an injury like a concussion, you can have physical symptoms, which I'll talk about in a moment. They include, headaches, dizziness, neck pain, and sensory sensation to screens. And if you have those physical symptoms, it really makes it difficult for you to focus and pay attention. And it can make the cognitive symptoms that are also associated with that slowed thinking, brain fog that we hear from people who've had a concussion. So you combine the physical symptoms and the cognitive symptoms, and you can get sort of easily overwhelmed, feel tense, a little anxious, can make you feel your mood be lower. And then you get into this cycle where the anxiety and the tension makes your physical symptoms worse. Then you have worsening attention, and you get into this cycle. And so exercise could theoretically break this cycle. So just to remind you, some of the symptoms, as I mentioned before, this is kind of the typical list of symptoms. You can have physical, cognitive, emotional, sleep changes that are all part of the concussion spectrum. And some of these things, headache, balance problems, dizziness, visual problems, fatigue, sensitivity to light, sensitivity to noise, and numbness and tingling, or feeling a little dazed, are part of what we might be able to help with exercise. The other thing that happens sometimes when things get a little bit longer is if you've been really uncomfortable with concussion symptoms for a long time. For example, you've had a really bad headache, you're very sensitive to screens, you have headaches, your symptoms sometimes may result in you worrying about doing anything, or what we call catastrophizing. And that means some people will start to avoid all activity. And therefore and one of the problems is that if you avoid all activity, you get deconditioned. So you're not able to do your normal things. And if you stop doing things, you get into this cycle where you're avoiding your symptoms, but you're getting into worse and worse shape. Your tolerance for things is getting less and less. And we know that the brain can actually get sensitized. So we're very aware that this whole vicious cycle leads to sometimes people becoming very activity avoidant and very afraid of moving. So if we if we continue this cycle, that can lead to irritability, sadness, decrease in neurotransmitters that are important for your mood. You can be more emotional and more anxious. So you're really avoiding things. Your mood is lower. And we know that exercise is an important role in maintaining neurotransmitters like adrenaline and serotonin. So this may be partially due to the concussion itself that changes the neurotransmitters, partially due to your inactivity, and partially due to your lack of exercise. So in summary, how could exercise help? Well, we know that exercise appears to increase nerve growth factors like brain-derived neurotrophic factors. And in normal populations, we know that people who exercise more have larger certain brain structures like hippocampi. So this suggests that the brain actually grows if you exercise. We know that there's a dysregulation of the blood flow, and maybe exercise could stimulate the blood flow to the brain and correct some of those changes in the regulation system that we have found in our research. The other thing is that exercise has been known to reduce perception of pain in many people, not everybody. That's through a number of mechanisms, but it is known to increase the presence of neurotransmitters in your brain that suppress pain. So you may have heard of endorphins. They're like morphine in your brain, and they can reduce pain. And also exercise helps to reduce migraine intensity. So we know that exercise itself may result in release of these endorphins and other chemicals like what are called endocannabinoids, which are related to cannabis, that may be helpful to giving you that runner's high, but also making you feel better after your concussion. So if people have started to really avoid things, the other advantage of exercises is if we can gradually reactivate people, it could reassure the people that the exercise is safe without markedly increasing their symptoms. And we know that exercise, as I mentioned before, increases the level of serotonin and adrenaline. And there's research that shows, just a recent publication where they looked at the effects of exercise for people who exercise and are depressed, even if they've not had a concussion, medications are almost as effective as our best medication treatment. So we believe this, for those who are really feeling depressed, it can be very helpful. And the other thing is that we've also observed that people with persistent concussion symptoms have disruptions of sleep. And many times when they've lasted more than 30 days, we know that people are not sleeping as well. And obviously, if you're not sleeping as well, you're going to be more fatigued, less activity, and therefore it's really critical to get a good night's sleep. And exercise is known to increase the quality and depth of sleep. So you can see that exercise has lots of benefits. So you might say, okay, all very good. Sounds really good to me, but wait a second. What about the risks? So there is a concern that if you do exercise and you get blood flow going, that the injured nerves may become more inflamed and swollen. This has been in the literature. And we also know that there's alterations in blood flow and there's differences in neurotransmitters that may be higher, like excitotoxic things like neurotransmitters like glutamate that may be damaging. And we've seen in animal models where we look at different models, like in different animals, that when they're exposed to concussion like forces, that there is a window of concern when the brain is very not ready for too much stimulation. And that appears to be in the first 24 to 48 hours. So that's the risks that we all have to face when we face exercise. And then, of course, there's other risks that we have to be aware of, like if you had a concussion and your balance is off, it's very possible that you will have to be careful about falling and hurting yourself again. So these are all considerations that we have to be aware of as we go forward with exercise. However, it's really clear in the lot of the literature that unfortunately, too many people have been told to rest for too long after their concussion. This has been a revolution over the last 10 to 15 years where it's been realized that complete rest until your symptoms are gone does not help you. So the current recommendations are, and they're phrased in different ways. This is from one of the statements, but they all basically say this, that after a period of rest during the first 24 to 48 hours after injury, that people can be encouraged to gradually and progressively more active while staying below their symptom exacerbation threshold. So that means you stay below when your headache's getting worse. And we'll talk about that as we go forward. And it's reasonable for athletes and everybody to avoid a very full blast exertion. So good to start, but don't push hard through this. So we still are working through this. So in summary of what we've talked about so far, exercise after that period of 24 to 48 hours could enhance brain growth factors, restore normal blood flow regulation, reduce pain perception, reduce anxiety and reassure people that they can do things and that it's safe, increase mood elevating neurotransmitters like serotonin, and improve sleep. So lots of great reasons that we should be doing that. So you might logically ask, well, what's the right dose and intensity? And so this is from a review, it really is evident that graded resumption of regular pre-injury activities seems to be helpful, and that delaying that resumption seems to mean thirst. So this is just a smattering of all of the literature reviews that are out there. There are probably about 10 now. These are just a smattering of the reviews where researchers looked at what's already been done. They took all the studies, they pooled them together to try and make conclusions, because obviously one study doesn't tell you the truth, but many studies might give you a hint that we're moving in the right direction. And so if you look across some of the studies, I'll just show you that this is a sort of a brief summary, and it's not all of them. And you can see that in studies of athletes and others, that in the individuals who are less than a few days after their concussion and more than even 4 weeks or 6 months, that that aerobic exercise has been used a lot. And we also see that some people are doing strength and aerobic exercise. And then some of the other exercises are called vestibular, which I'm not going to talk about. That means exercise for dizziness. So we've got lots of reviews. So here's the general rule of thumb for activity. This is kind of like the Ontario Lottery and Gaming slogan, know your limit and stay within it. So I think it's really important for people to remember this. If you learn nothing else from my chat today, this is it. So then you might ask, well, how do I know what my limit is? So I wanted to introduce you to one of the ways in which we know what the limit is. This test is called the Buffalo Concussion Test, treadmill test. And in this test, the participant walks at a brisk pace on a treadmill, and the speed is constant for the first 15 minutes. And every minute, the treadmill's inclined. And once it meets a max incline, the speed is increased. So we watch this. I have a video for this, and I'm going to stop sharing for just one moment. And I'm going to take you to the video, and we will see if we can get it working here. I've got to share my screen. And this is my colleague, Evan Foster, at the Halalis Clinic at UHN. And let's just share screen. Make sure I've got our sound. Okay, here we go. So I'm going to just get the high sign from Christian if you can't hear it. So this is a typical concussion test.
Good morning. So we're going to do the Buffalo Concussion treadmill test now. So what we're going to do is we're going to get you on the treadmill walking at a brisk pace. So you won't be running, you'll just be walking fast. Every minute, we're going to increase the incline as long as you're not symptomatic. So at the end of every minute, I'm going to ask you about any symptoms you're experiencing. And if your symptoms do start to increase just by a little bit, we'll stop there and we'll do a quick cool down. Okay? I'm also going to ask you about your exertion every minute, and I'll show you the scales before we start. To monitor exertion, we use the Borg RPE on a 6 to 20 scale, with 6 being no exertion at all, up to 20 being maximal exertion, the hardest they've ever worked. To monitor participants' symptoms, we use a visual analog scale, where 0 is they feel terrific, they have no symptoms at all, and 10 being the worst, that they feel terrible, the worst they've ever felt. Ready to get started?
Yeah.
Okay. We're going to start the treadmill. Based on your height, we'll be walking at 3.2 miles an hour, which is about 5.1 kilometers an hour. Like I said, it'll be a brisk pace. This is the pace here. So as we come up to the first minute, I'm going to see if you can give me your heart rate again.
89.
89. And how's your exertion?
Probably an 8.
8. And your headache?
The same. It's like a 1.
Dizziness?
About the same, a 1.
And nausea?
That's the same.
Okay, okay to go up?
Yeah.
Okay, I'm coming up to 4 minutes now. Did I get your heart rate again?
It's 104.
4. Your exertion?
14.
14. Your headache?
That's a 2.
2. Dizziness?
Probably a 2 now.
Okay, and nausea.
That's the same, like a 2.
So we're actually going to stop there. So I'm just going to bring you down to 0 incline first. And just bring you down to 2 miles an hour, or about 3 kilometers an hour, just to cool down. You don't want your symptoms to increase any more than that with exercise. And so we're going to do 3-minute cool down, and we'll do the same kind of readings at 1 minute and then at the very end.
Okay.
So that's the test, and it's been very useful for understanding how much people can do, and it also might help you understand what you can do, because many of the folks they don't really understand how far can I push myself, so they're doing this supervised test where they can see. So as I said, the test, like as you saw from the video, the test is stopped when the person's score on their pain or their symptom scale goes up by 3 points, if they get to 20 minutes, or if they reach 80% of their age predicted max heart rate. We're going to talk about that in a moment. Or if their exertion is greater than 18, or if they get any fatigue or cardiac symptoms, which is very unusual. So how do we progress? Well, I think you may have seen this, but it's important to remind you that we have a sort of 6-stage progression for people to go through, where they start with rest for the first 24, 48 hours, and light activity. This should be, just at a low level. And when they get comfortable doing that, you will look at starting to do skating drills and sport-specific exercise, but no contact. And you're just basically skating around doing and seeing if your symptoms get worse, or if you're running, or you're riding your bike, or whatever. And then you move into non-contact drills where there's no problems, and there's recommendations for continuing to do some exercise strengthening at that point, and then you return to full contact practice and you return to play. And in general, for an athlete, this will take a minimum of 6 or 7 days. So we wondered, okay, that's all very good for athletes, and there's lots of studies in athletes. What about if we try and do this in the general population? So we did a study, which I'll just touch on. We we said, what if we took people who came to our clinic at the Hull Ellis Clinic, we get people referred from emergency rooms. And we said, what about if we were able to try this in this group? So we gave people either a very usual care, which was we handed out some exercise suggestions, or they got 30 minutes of a very prescribed high intensity exercise, which was prescribed based on their Buffalo concussion test. And then we do the treadmill testing in 1, 2, 4, 6, and 8 weeks until they're better. So we had some people who couldn't include if they were on medications, if they had very severe heart disease, or if they really had didn't have this response to exercise, and if they were already better. For example, if their symptom score was less than 9, that means we almost consider them better. So the groups were pretty much similar. We compared them to our general population, and here's what happened when we gave them. So on average, people went about 10 minutes. Their heart rate was about 130, which is good. They got to about 70% of their predicted age, predicted heart rate. And even at week 1, many people already reached that 80% threshold that's considered recovered according to the BCTT. So this 0.8. So you can see some people were really doing well. On the other hand, some of the people were not able to get that far. So these people with the lower arrows. So what we determined was this was actually feasible in a non-athletic group. And so we took them through a very tight exercise prescription based on how far they went and we gave them, this is how many minutes we're recommending, and this is what your target is for your heart rate. And we gave them a heart rate monitor, and you can see that unfortunately, people didn't remember to wear or didn't wear their heart rate monitor. And so only about 30% of the time did we really get to see what their activity levels were. So this is one of the challenges in this group. And so then the other thing is that people who went in the treatment part didn't always follow their prescriptions. So we thought that if you did your exercise 3 out of 5 days, that's pretty good. So out of 10 participants who got this, only about 12 out of the 28 weeks, people actually were able to keep to this. So we decided that this means that prescribing exercise may be really challenging. So we looked at who'd recovered based on our clinic doctors, based on their symptom score, and whether they could actually go to 80% of their age predicted heart rate on the Buffalo concussion test. And the good news is that even in the fact that people didn't always follow the exercise, that those people who actually were in the treatment control group seemed to recover faster than the people who were not. And so that's a good sign. So it looks like that it's feasible to test it. But we know that not everybody has a treadmill in their clinic. The family doctors certainly don't. And so we asked ourselves, can exercise be prescribed effectively without this rigorous testing? So this is a study from Mike Hutchison, who is at the University of Toronto at the High Performance Athletic Center. And their group took 39 people who were younger athletes at the university. And they said, okay, we're not gonna test them. We're just gonna give them a structured instruction. So we're gonna say, okay, you wanna do some exercise and you wanna go at 60% of your age predicted max. You wanna do it for 15 minutes with a 5-minute warm up and a 5-minute cool down. And then increase by gradually based on your heart rate. And what was interesting was that by 1 month, the people who just followed these instructions, they didn't have any testing. The people who got to this sort of 60% of their max and did it for 15 minutes were much more likely to be recovered than those people who had. So remember, when we did this in our clinic, almost 95% of the people. So remember, like if you think about Mike Hutchison's data, when we looked at the general population, virtually everybody in our testing was able to get to 50%. So that's good. They don't necessarily need a test because they all can get to 50%. And then if you look at it, it suggests that this could be this structured exercise could be more feasible than doing testing on everybody. And here's another study that sort of suggests that we really need to focus on just the amount of exercise. So this is a study by Howell, and they also did randomly allocated people to either a specific exercise prescription or to just people following them up. And what was interesting was that what they found was that at 1 month, there was no difference in whatever group that you were in. But when they actually looked at the people who had done the exercise as prescribed, that means to say, if they'd actually achieved 100 minutes per week, which remember, that's the 20 minutes that Mike Hutchison did, you can see that this group were all less symptomatic. They all had lower symptoms than the group who didn't exercise 100 minutes a week. So this is, again, giving us the signal that if you just focus on getting in the exercise without hurting, without overdoing it, you may be able to do this. So it doesn't matter whether you were randomly allocated to a structure or a standard of care. If we monitored you and you got more than 100 minutes, even if you were not given a structured exercise prescription, if you're greater than 100 minutes per week, you did better. So here's a few takeaways from all of this. If you don't have access to a Buffalo concussion test, that's okay. So remember, start activity that is tolerable, given your other potential causes of pain like neck, knees, hips, ankles, walking, stationary biking, sometimes swimming if you really like swimming, although some of my dizzy concussion patients find it very hard because of the waves in the pool. And then you can calculate your age predicted maximum heart rate. So how do you do that? Well, if you do 220 minus your age, you can calculate your target, your maximum that you should be going to. So what does that mean? Well, let's do one calculation. 220, if you're 45 years old, take away 45. That means your target max rate is about 175. So your aim is to get to about 50 to 60% of your max for your session. So just based on that, you could get to, roughly 110 or so. You can calculate. It sometimes helps if you have a heart rate that is monitored. Like if you have a heart rate monitor, you can know, well, my base heart rate is 60. And so the difference between 60 and 175 is this. So I can calculate roughly where 50%. But again, you could just do a very good calculation by just doing that calculation. So the other thing is, know your limit and stay within it. And you do not want to go to your maximum time. If you know that you can exercise for 15 minutes, great. If you think you can only exercise for 13 minutes, great. Just do 13 minutes. And if you really can't do more than 5 or 10 minutes, just try and get in that 100 minutes by going twice a day for 10 minutes. Okay, so I thought I'd just do a little teaser because when I was doing my research for the talk tonight, I found this article because I think a lot of people were curious about this. And what about exercise as a prevention of concussion? So there was a nice systematic review by this group that was just published in 2024. And what they did is they found 25 articles looking at whether neuromuscular warm-up, neck strengthening, or in either static or dynamic exercises was helpful. And what they found was that over reviewing all these articles, that if athletes do strengthening exercise, it does improve their neck strength on measurements. But when they measured their linear or rotational head accelerations, for example, by putting a monitor on their helmet, that the neck strengthening did not result in reduced head acceleration. And it seemed that if you were doing more multimodal exercises and more dynamic, you seem to improve your strength more. Unfortunately, none of these studies where looked at the outcome of whether it reduced the incidence of sport-related concussion. So we don't know if exercise reduces your risk of concussion. So just to finish up so that we can open up for questions, what are the take-home messages about exercise prescription? So after the first 24 to 48 hours, exercise may improve your recovery through better brain function, blood flow, neurotransmitter, mood, pain, and sleep. So what dose? Well, know your limit and stay within it. You can, if you have access to a test like a Buffalo, it can give you a very tightly prescribed, and perhaps you can base it on your age. 50 to 60% times your 220 minus your age. And finally, it does seem to be promising that really should improve your symptoms. And I just want to acknowledge a very large group of people at the Canadian Concussion Centre, as well as at the Hull Ellis Research Clinic at Toronto Rehab, who've contributed to all the data and help us collect the data that we've shared in this talk today. And with that, I'm happy to answer questions. And I haven't been watching the chat, so I'm going to stop sharing if it's okay. You can follow us on X at Hull Ellis CC. Thanks.
That's great talk. Really interesting, Mark. Thanks so much. We do have the questions are starting to come in now. Mark is asking, with respect to the effectiveness of exercise treatment on concussion recovery, have there been studies which consider the severity level of the initial concussion or break the results down into usefulness for different concussion types? In essence, are there different exercise recommendations or progressions depending on the severity or type of concussion?
So that's a great question. I think there's two parts. So the first question, I think you asked about severity. So as Dr. Tatter and others may have talked about, one of the biggest determinants of how severe your concussion is actually how symptomatic you are. So we use standardized scores like the Sport Concussion Assessment Tool or the Rivermead. These give us a count of how many symptoms you have. And we know that that's in a person who had a concussion. And by concussion, just qualifying that for a moment, we're not talking about people who had a bruise in their brain or who had a hematoma in their brain. When you have loss of consciousness for a long period of time, more than 30 minutes, or you have a bruise in your brain, most of us in the concussion field consider you to have a complicated mild traumatic brain injury as opposed to a concussion. So answering mostly for that concussion group that doesn't have any bruises in their brain and who had maybe a brief loss of consciousness and a high number of symptoms, it does seem that exercise works for any severity of symptoms as long as you target those symptoms. So as on the Buffalo concussion test, you'll notice that our participant after 4 minutes started to experience symptoms. And we would expect that some people would only go for a few minutes, and that would be the indication of how significant their symptoms were. So that's the first piece about the severity. If the person had more symptoms, we know that probably exercise helps, but they're also more symptomatic. And the second question was, is there a type of exercise? So this is a great question. There's been a lot of research about, can we profile concussions or put them into what we call types, or in fancy language, that means phenotype. And some people used to believe that, oh, well, this person's got like a neck concussion. So they've got a neck plus concussion. And that's the presentation. Some people have more eye symptoms plus concussion. And so it does. So the short answer is, when we blend all of this into data sets, it doesn't seem that you can pull out these classic types. However, the way we treat people in our concussion clinic is that if you have a lot of neck symptoms, and our examination shows that your neck is really restricted, we would prescribe physiotherapy that's targeted at your neck, separate from this aerobic exercise. And likewise, if you have a lot of dizziness and you have signs that the inner ear was shaken, we will recommend that you participate in vestibular rehab. So yes, indeed, we do tailor everybody's prescription to their symptoms and to what we find on their exam. But there hasn't been this, oh, you look like this. We tend to look at the symptoms the person has and tailor it to trying to treat them. So I hope that answers your question. There were two parts to that. I hope I got them, Leslie.
Yeah, that's great. The next one is, what is the general recommendation if any form of exercise triggers symptoms which go above tolerable levels?
So again, one has to start somewhere. And if somebody's really, really symptomatic and can't do any kind of exercise, we may recommend that they just do a brief walk around the house, right? That's where you're starting. But every day, trying to do a little bit more, because we still believe that physical activity and aerobic exercise may have benefits. Yes, maybe you can't get to that 10 or 15 minutes, but we still believe it's worth it. If there's some reason that you're symptomatic, so any symptoms, it really is important for you to be properly evaluated by a concussion specialist to make sure that we're not missing anything, like an injury to the neck or something that may be making exercise so intolerable for you.
That's great. Thank you. Next question is, are there some exercises that we need to be careful around because it could result in our brains being shaken in our skulls?
Great question. I think that we all have to recognize that certain exercises are going to be more likely to cause injury than others. So the short answer is just exerting yourself is not likely to shake your brain. However, we all love different types of exercise. So if we're riding a bike, that exposes us to more rattling as we go over bumps and more jarring as we hold on, as we go over the potholes that are in Toronto or wherever you are. So these are all subject to some injury or strain on the neck and may exacerbate your symptoms. Likewise, if you're a hockey player and you go out and skate, you're at risk of falling. You may notice that more vigorous or bouncy exercise may be more symptomatic than others. So this is why we really like walking, running, if it's a stationary bicycle. And in those people who don't have a lot of dizziness, maybe swimming may be helpful. So the short answer to your question is no, exercise in itself does not cause shaking of the brain, but the type of exercise you choose may put you at risk of exacerbating some of your symptoms, particularly if you have a lot of neck symptoms, eye symptoms. Like a lot of my patients have told me, if I go outside and it's, sunset like it was just now, it's just the sparkling through the trees. It just drives me nuts. And so, these are things that you have to consider in selecting your exercise. If you're running through, a tree covered thing and the sun is just about to set, that could really trigger people who have a lot of sensitivity to light.
Great. Thank you. Most of the studies that you referenced had young subjects. Are the results applicable to adults over 60?
So the great question, and I always have to say there are limitations. We don't have as many studies in older adults. However, the studies that we do know, in other populations, for example, exercise in stroke, exercise in other kinds of brain injuries, exercise in cardiac rehab, we believe that the benefits are the same. We just aren't as certain because it hasn't been tested in this group. So I think, if you are over 65 and you're concerned, this is where you might go to your doctor if you have any cardiac issues or blood pressure issues. And this might be a perfect person for whom an exercise test might be helpful.
Great, thank you. Mark is asking, I was concussed about 5 years ago, is having persistent symptoms since then, especially when I exercise, which I like to do as I've always done so and am in good shape, but getting deconditioned now. Have seen about 5 different physical therapists, but each session produces extreme symptoms the following day. And they're asking, Any suggestions?
Oh, Mark, I really understand this is a very difficult challenge. And so my main comment would be, and this is what we see sometimes in individuals with other conditions like long COVID, is they don't experience the symptoms when they're actually exercising. So they feel rotten the next day. So, and it sounds like you exercise is limited. So you have to judge the amount of exercise based on your next day. So again, if your next day is really bad, I usually recommend to people that they use that as their sign that they overdid it and that they back off a little bit in the day before, like when they're exercising, because they haven't yet found their limit and staying within it. That being said, we do take when somebody's had a concussion for a long period of time, we do look at all of the different things on that vicious cycle I explained before. We look at, is there anything else we could treat? Like, is the sleep something we could treat better? Can we improve headaches? Can we improve mood? Can we improve other things? And so usually when you've got to a long period of time, we have to break down all of the symptoms and say, have you been maximally treated for every single one of the parts of the vicious cycle? And then hopefully that would result in improving in exercise. But if you're not sleeping and you have a wicked headache and your mood is not so good, it really needs to be individually addressed, because we believe in splitting the symptoms up and trying to tackle them the best we can. So that would be my sort of recommendation, although I can't give advice that's specific to you. I could say my general advice is try to look at any of the symptoms and see if we can make any individual symptoms so that your burden of symptoms goes lower.
Great. Thank you very much. Okay. This is a great question. And I have to say, I think this is the first time this has been asked.
That sounds tough.
Get ready. No one seems to be talking about sex and concussions and what is permissible. And it says a woman asking here, is arousal a risk? Orgasm, is that a risk? Is there a time period after concussion when one can resume sexual activity? I'm talking both about partner sex and masturbation.
Okay. Thank you for the question. We always forget to talk about this. And in an act of shameless self-promotion, I'll tell you that we just released some guidelines on sexuality and intimacy after brain injury that are in the Journal of Head Trauma this month. So here's the things. Let's talk first about your question about exertion and arousal. So exertion, we generally said to our cardiac patients, if you can climb 2 stairs, you're safe to go, have sex. So in general, there's no reason to believe that from a physical point of view that getting engaged in sex isn't fine and a great idea. Problems that people run into. Some people have reported, particularly those with migraines, that they may have when they become aroused or orgasmic, they may get a post-orgasmic headache. That has been reported in people with migraine. And so obviously, if that was the case, that individual would need to go to a specialist in migraine to try and manage that better. We've also heard that individuals have difficulty with arousal. So if people have difficulty with arousal and actually getting to orgasm, this has been reported in brain injury, and it may be a disconnection between the different neurotransmitter systems, and you may not experience it. And it may be combined with many other factors like mood, your anxiety levels, your comfort levels, pain. You can't relax, and this can be a problem. So we generally recommend, and this is in our guidelines, that if an individual is having troubles with arousal and getting erections or other sexually aroused, that they be seen by a specialist to make sure there's not any hormonal changes after their brain injury, to make sure there's not any medications that may be interfering with sexual performance. And so really important to do a very good workup but the message should be that it's good, and if it doesn't exacerbate your symptoms, it's probably important for relationships. We know that intimacy is important for relationships, and so there's no medical reason why you shouldn't try. But it's important to communicate with your partner when your symptoms are exacerbated by any position or any movement. So these are all going to be, communication is the key, and really important. If you're still persistently low libido or things like this, these are things you really should have an expert see you, a psychologist, social worker, and or a urologist or specialist in sex. Certainly, for people who've had symptoms for a long time, it's really important because it's obviously affecting. If you're a couple, it affects you as a couple, and it may be really important to bring it up. And I will apologize on behalf of all of us health professionals because we don't ask about it enough. So
Yeah, thank you for asking.
thanks for asking.
Yeah, we have a question from someone regarding beta blockers, and they're talking about how it's hard to progress the exercise
Sure.
using symptoms, and they haven't been able to find a physio to sort of help guide them. And they're wondering, how can I follow these exercise prescriptions and follow heart rate while using a beta blocker, because they find that their symptoms are sometimes.
Yeah. So this is a great question. So for those of you who haven't heard of the name beta blockers, the beta receptor is one of your adrenaline receptors. So when you get the fight or flight response, one of the receptors that turns your heart rate on, raises your blood pressure, and all these other things, called the beta. So it's basically giving you that kind of readiness to run and fight. And people who have blood pressure issues or headaches or other things may be placed on beta blockers for treatment. So yes, it does blunt the response to exercise. And so people will not reach the same level of exercise. So you will not typically reach your exercise target. However, the general recommendation is still the same. If your maximum was 30, still could take 50 or 60% of that as your exercise. If you're really not sure and you are on a beta blocker for high blood pressure, this is another indication where it might be good to get referred for an exercise test, so that you can see. And the other thing is, I'm not giving specific advice to any individual in the crowd. However, just to remind you that there are also many, many more blood pressure medications on the market. And in this instance, if you're not on a beta blocker because you have migraine headaches or other reasons, you may consider going to talk to your primary care practitioner about, should I be put on one of the other medications? There's different medications, calcium channel blockers, which dilate open. There's, angiotensin converting enzyme inhibitors. There's a whole bunch of things that we have in our toolkit now that could help you to find another medication if you're really getting a lot of side effects.
Great, that's excellent. Thank you. Are there any special considerations for individuals who have experienced post-concussion seizures? Is there any different process for when to start or medical clearance required for light aerobic exercise?
So, we know that, if you had a seizure, that seizures do occur occasionally, and this is not my area of expertise. I'm not a neurologist by background. However, if you did have a post-concussion seizure, you probably should have been worked up at an emergency room just to make sure that there was no brain bleeds or anything. If you've had no symptoms, it's not unusual that occasionally people will have a few shakes of a seizure, and it doesn't necessarily appear that just because you had that, you have a worse prognosis. However, you do need to be worked up to make sure that you are safe to exercise, or you didn't have any other reason like a brain bleed or something. It's probably a good idea. So it doesn't mean you necessarily need a scan, but you probably just need to make sure that somebody's looked at you before you exercise. So in general, a very early seizure, if you've gone through that first 48 hours, probably okay to do something. Although, again, qualifying it by if there are any other signs of any other things, you need to see a specialist in seizures.
Great, thank you. Next question is, will yoga or Tai Chi work as a daily exercise choice if you do a more aerobic exercise like cycling at least once weekly?
Yeah, so the question is about yoga and
Yes,
Tai Chi.
yes.
We love yoga and Tai Chi. It's great for your range of motion, good for your neck, good for those things. It may not get your heart rate up into the target zone. So yes, it may be necessary. There are vigorous forms, obviously, of Tai Chi and yoga that might actually get your heart rate up into that range. But yeah, I think those are all great additions to the activity that you can do.
Great, thank you. Sorry, there's a lot of questions and I'm just
That's
trying to,
fine.
I don't think we're going to get through every single one. Um, how do you find someone that can do the Buffalo concussion test with you?
So that's a great question. There aren't many places. Usually, if you're going to do it, it's going to be at a sports clinic that has experience with it. And again, uh, you know, can't really one way can't give you exact names, but we do have if you're in the Greater Toronto area, we did create a tool that's on the Toronto ABI network website called Concussion Navigator, in which my friend and colleague Evan and Julie Osbelt from the ABI network called all the clinics in the GTA and actually found out what services they offer. So you can go in there, put your postal code and your symptoms, and you may be able to find a clinic near you. I'm sorry this resource doesn't exist across Canada. We're working on it.
Yeah,
So I
yeah,
don't know of many clinics that are offering it, but you might find it in a sports clinic. Yeah.
that's great. This one's a bit different. Could you clarify why concussions and mild TBI are used interchangeably, as many medical professionals and physiotherapists and OTs all have used it as if they are the same? I have a skull
Okay.
fracture. Sorry, there's a bit more. I
Yeah.
have a skull fracture from the back of my head to my face, brain bleed,
Mhm.
loss of consciousness, and loss
Mhm.
paralysis from waist down, and couldn't walk for 2 years. Also changes in balance, smell, and so
Mhm.
forth. And I've had many therapists call me a concussion patient when I was told I have a moderate to severe uh, TBI.
Yeah. So, not to get into too much of the research around this, I am lucky enough to be part of a working group that's an international working group trying to overhaul the classification of traumatic brain injury in some way, because we know that we base the classification based on whether you had a Glasgow coma scale and you were lost consciousness. So even if you didn't lose consciousness, but you had a fracture and you had a brain bleed, you could have had quite a significant injury to your brain. What most of us would consider at least a bare minimum complicated mild brain injury or a moderate or severe. So anybody who has a fractured skull or has a brain bleed are not concussion. They're at minimum a complicated mild brain in our classification for most. We're working on it. We'd like to have blood tests we can do to see how much brain has been injured. We love to do an X-ray or an image that could tell us how. But at this point in time, just to help you, a concussion is generally a term used for a mild traumatic brain injury, where the Glasgow Coma Scale is greater than 13. People aren't unconscious for more than a few brief seconds, and they don't have any intracranial hemorrhage. That's what most of us use the definition. Mild traumatic brain injury includes people who have a concussion, but it expands a little bit to include people who still had that Glasgow Coma Scale that wasn't low. They weren't unconscious, but they may have had a fractured skull or a bruise. So the two are used interchangeably. However, we consider them differently in terms of treatment and awareness, because we think that if there was a bruise in your brain, it may have been worse. So I think that, we can't answer any individual person's question, be very specific, but anybody who had enough force applied to their skull that they had a fracture and who had bruising and was, disabled with motor findings for 2 years is at least considered a complicated mild or moderate traumatic brain injury.
Absolutely. Thank you. Okay, I'm going to sneak in one more and then we'll finish. Nisha is asking, is weight training okay? I've had different answers from different physios. I've lost a
Sure.
lot of muscle mass and would like to be doing weight
Yeah.
training.
So thanks for that question. I know this was asked, this was in the things. So first and foremost, yeah, the research is a lot focused on aerobic exercise. There was one or two studies, as you might have noticed, that looked at resistance exercise. And I think it's fair to say that resistance exercise is okay. However, here's the challenge. Um, resistance exercise, when you pull your arms really hard or you strain to lift, what happens is you may you may close off your chest, and that's called the Valsalva maneuver, which means you don't take a breath, you really push hard, you straddle yourself, and you may have heard your instructor say, breathe through it, breathe through it. And the reason is when you increase the pressure in your chest, you decrease the amount of blood flowing down from your head or returning from your legs because you've got this pressure. It's pushing out on your chest to keep you lifting that really heavy weight. So any exercise that involves really straining and closing the chest and straining uh, will increase the intracranial pressure a little bit, and it'll increase the blood flow, like it'll increase the resistance to blood flow returning from your legs. So resistance exercise is good as long as you breathe through it and you do not close your chest, because that may increase your symptoms in your head and may increase your, so yes. So how do you do that? Well, if you're doing anything really like a whole body exercise, you really have to make sure you're breathing through it, and you have to build up very, very slowly. If you're just doing arm exercises, sure, just isolate the arm, lean on a rest and do your biceps. You can go ahead and do that. It's not going to increase your pressure as long as you don't do any of that straining. Ugh, none of that. Okay.
Yeah, that's great. Thank you so much, Dr. Bayley. That was excellent. We got through a lot of questions. I'm sorry we couldn't get through all of them. Just as a reminder, for those of you watching, you will receive a short survey. And if you have just a minute or two, we really appreciate your feedback, any suggestions. Also, if you do have any questions, this happens sometimes. People have a question they really want to get answered, and they'll put it in, but we don't actually have your contact information. So if you want to be contacted directly, just put your email in there with it. So, and also our next talk will be in 2 weeks, and it's going to be, actually I'm presenting, and it's going to be on mental health after concussion. So thanks again, Dr. Bayley, and thanks everyone for attending tonight. Have a good evening.